many consider this a radical approach. The mayor has supported the concept for years. He wants to mirror what's going on at the 2 New York facilities, but he can't make it happen on his own. He needs enabling legislation from state lawmakers to do it. Bills creating a supervised consumption pilot program have already been filed in the House and Senate. And based on his enthusiasm, the mayor may be the first in line to testify in favor.
In order for us to be able to get people the treatment that they need and when they're ready for it, right? And to get them into the places and spaces they need, the first thing that they have to do is be alive.
In a one-on-one interview with 11 News Investigates, Mayor Brandon Scott revealed his desire to open 2 supervised illegal drug consumption sites in the city. His model is On Point NYC, a place he has visited, a judgment-free zone where people bring in their own drugs, sign in, and write down what they're using. The goal is to keep people alive until they're ready to seek treatment.
This is something that we want to bring to Baltimore.
11 News Investigates toured On Point NYC in September. It's a nonprofit funded through the New York Health Department, federal grants and donations. The facility provides a safe place to shoot up, smoke crack, or snort.
And it is all about saving lives.
Baltimore County Senator Shelley Heddleman has visited On Point as well. She already filed legislation that will enable Baltimore City to open 2 of the proposed 6 operations statewide. The state health department and local health offices will approve the facilities and sites.
This is not an imposition on anyone. The impetus has to come from the local community and a local organization, and it's a pilot program, and it would create and enable 6 different sites around the state, 2 urban, 2 suburban, and 2 rural.
On Point operators say it only works when other services are available. Senator Heddleman's legislation provides a holistic approach. Mayor Scott says he plans to testify in favor of the bill.
These public health-based approaches that have worked in countries all around the world and now working in places like New York should be brought here.
Similar legislation introduced over the past 3 years have failed. The new pre-file bills require operations to be located in high drug use areas, and it calls for reports to be filed each year on a wide range of topics, including the number of overdose interventions and referrals to other programs. The pilot program would be in place for 4 years. Reporting live from the newsroom, David Collins, WBAL TV 11 News.